So now we come to the fourth video in the series on menopause and menopausal symptoms. And this one is a relatively short one, hopefully, on what alternatives to HRT there are should lifestyle measures and herbal and all the other things that I mentioned previously not be adequate, or whether or if there may be other reasons why why some form of medical help may be required, such as an early menopause. So in terms of alternatives, it depends a lot on what the issue is, whether it's sweats, flushes, mood, or whether it's I've been through an early menopause and although I'm not feeling too bad myself, I'm worried about the impact on my bones. And these things are largely handled a little differently. A number of the preparations I'm going to be talking about today are not technically licensed, well, they're not licensed for menopausal symptoms. Most of them have been used for many, many years, and there are variable levels of evidence to support them, but they are what's known as unlicensed, which means that there isn't specifically a license been sought by the people that produce that medication for it to be used for that purpose. This means that if somebody's going to prescribe that, they've got to be happy about prescribing it for that particular reason. You will find that some GPs are more comfortable with it than others, depending on their level of experience in this area. Most practices will have a GP that has a particular interest in this area, and it may be better to go and see them because they may be more comfortable in exploring the options with you. There are also a few specialist menopause clinics that are available. Some are private, some are on the NHS. There aren't that many of them, but you can be referred to them should there be particular problems or there being more specialised input needed. So going through the sort of symptoms that we have, well, looking at first of all sweats and the flushes and things like that, which tend to be the thing that most people come in and say I'm struggling with. And if you're not taking HRT, there's one particular medication that's licensed for this. It's known as clonidine. Now, it is licensed for it, but in my experience, I haven't found very many people do particularly well with it. I have had one or two who've taken it and it's been absolutely great, but I've also had a lot of people come back and go, I'm feeling really lightheaded in it, I don't feel well on it, I'm getting headaches on it, and I'd rather not take it, thank you very much. Are there any other options? But I really don't want to take it. What I will say about that is it was originally designed as a blood pressure tablet, and it's very good at getting blood pressure down. Now that can be an advantage if your blood pressure tends to be up, but what it does mean is if you're taking more than a little tiny dose, if you stop it suddenly, your blood pressure may suddenly shoot up. So it's something that if you do start trying it, it needs to be stopped gradually. And yeah, some women do use it, but like I say, a lot have come back to me and said, actually, side effect wise, I really don't like it. The other unlicensed, and the one that is actually mentioned in the NICE guidelines, is actually use of certain types of antidepressant. Now, a lot of people get very scared when you say the word antidepressant. You hear all sorts of things about, is it addictive, and am I going to have problems coming off it? What about side effects? I'm not depressed, and all those kind of things. And yeah, I get that, I hear that a lot. Now, the thing about antidepressants is, while they are not addictive, there are some people and certain types of antidepressant that people often have quite a number of sweats and feeling off colour, dizziness and things like that on stopping for sometimes a number of weeks. And that may be a reason for some people in terms of not taking them, but equally well, lots of people do manage to start and stop some of them fairly readily. I would say that for a lot of people they do seem to work pretty well, and I've had a number of women who haven't wanted to take HRT or haven't been able to take HRT who've actually done very well on antidepressants. Now, when people used to go to the specialist menopause clinics, the one that tended to get used quite a lot is one called venlafaxine, and that's probably the one that has maybe a little more evidence behind it, although I don't know that it's that well supported compared with other antidepressants. The One thing I would say about that is we do know that it can put your blood pressure up a little bit, so anybody that's on that needs the blood pressure monitoring, much the same way as we would if they're on HRT. And it is also one that's one of the ones that can be harder to come off. And often people that have been using it for depression, which tends to be much higher doses than we're using for menopause, tend to have to cut it down gradually. I've also found that some people have a bit more side effects with it, so I've tended not to use that one primarily as a first line in this kind of situation. Mostly it tends to be fluoxetine, which is otherwise known as Prozac, and there's another one called citalopram, which also has some evidence behind it, which can be used, and it's also used for depression and anxiety in a lot of people. I tend to use fluoxetine most often for women, and occasionally others in the same family, which seem to work fairly interchangeably. And you usually find that it can be helpful with the sweats and the flushes. Not quite sure of the mechanism of that, but it does seem to work for a lot of women. And the advantage of it is obviously it's not hormones going into your system, it's just something that you're taking that evens things out while your body works its way through. And for some people that is adequate, and you can take it for as long or as short as you wish in this kind of situation. The NICE guidelines say that if the person doesn't have anxiety or depression, out with the menopausal symptoms, because obviously I've mentioned previously mood swings can be part of the menopausal complex, that if they don't have those symptoms out with the menopause, there isn't particularly good evidence in using antidepressants in that time frame. I would say that from the patients I've used it with, it's actually worked quite well for a lot of them. And I've also found that the people that have the perimenopausal PMT mood swings, there's an odd thing that I'm not the only one that's remarked on this. There's a number of doctors that have found this, that although biologically it doesn't seem to make a lot of sense, once you've got somebody established on it, taking it cyclically during the couple of weeks where your mood's going to be bad in the month, when you're getting those premenstrual dips in mood, can actually be as effective as taking it continuously. I don't know why, but for some people it does really seem to work. So it is an option. It's not licensed, but it's acceptable use provided your doctor's prepared to prescribe it for you. NICE also mentions that when you have mood problems, cognitive behavioural therapy, which obviously doesn't involve taking any medication, which is a big advantage, can be really helpful for the anxiety, depression, low mood, confidence dips that associate with the menopause. And this is whether or not it's menopause related or whether or not you have those particular problems. The cognitive behavioural therapist, that's a talking type of therapy where they look at how your thought patterns process in a particular situation and help you to set achievable goals to try and help you build up coping strategies. There's good evidence for its use in depression and anxiety. They use similar techniques for the mood associated problems to do with the menopause. There's also some evidence that it can help with the sweats and the flushes. However, I would say in terms of that evidence, you're probably going to need a fairly prolonged course of it, and finding a practitioner that's happy to work through that aspect on the NHS may be rather difficult when most of them are focused primarily on mental health rather than something like the menopause. It is, however, good for the right people, and it's something that's certainly worth exploring. Other than that, there's something called gabapentin, which can be used for hot sweats and flushes. What I will say about that is it's a controlled drug, which means there's certain restrictions as to how much we can prescribe at any one time, and we may be a little bit more reluctant to prescribe it. I'd also say the evidence for this one's a little bit more sketchy, and personally I've never actually used it in somebody having menopausal symptoms. Other than that, if just pure sweating is a problem, again, this is unlicensed. There's a medication called oxybutynin that's primarily used for irritable bladder symptoms and overactive bladder, that at a dose of 3 milligrams twice daily can be used off-licensed for sweating, and a lot of dermatology clinics use it for people that have excess sweating. I found that the 2.5mg dose, which is much more readily available, seems to work adequately for a lot of women, and I have used that off-licensed, and for some people that just helps give the certain edge, and so it's fine to explore. So those are the sort of things that you can discuss with your GP, that they may be able to put you in the direction of or prescribe for you. The other aspect I'll mention is if you've been through a premature menopause and you're concerned about your bones, but for some reason you either cannot take HRT because of cancer risks, or you've had breast cancer, or you've or you feel that you do not wish to take HRT, then I would be suggesting that you have a discussion with your GP about your bone health. Obviously, the lifestyle measures of plenty of calcium, vitamin D, making sure that you take regular weight-bearing exercise, and keeping your alcohol down to sensible limits and stopping smoking all apply, but it may be worth discussing with your GP at what point they consider possibly giving you a scan to see what your bone health is like, because if you're not taking HRT, there are other preparations that can be used to build up your bones. This is a quick romp through some of the physical symptoms. I'm saving one of the ones that is often traditionally dealt with in this area for the next one, just for completeness sake. The next one I'm planning on talking about sex, libido and dry vaginas.